checking in relaxation practice that has to do with the theme. So,
Is that new?
no, but I just never, I'm so untechnologically savvy.
I saw a light. The red light.
Okay, so go ahead and close your eyes and just take a few breaths. Just getting fully present here, now, in this room. Feeling your bottom in the chair and the support of your pelvis and your spine. As you breathe air in and out, just feeling your ribs expanding and relaxing. You might hear the clock ticking or the sounds inside or outside. And just sort of scan yourself right now, right here in this moment. And just notice if there's any emotion bubbling up, maybe about the day or any stresses or how you feel about your pain. Just notice that emotion. And initially, when we're feeling some way, we'll identify with it. I feel fill in the blank. Might be overwhelmed or anxious or hurried or depressed or worried or sad. Or I'm feeling. Sometimes we don't even put in the feel, we just say, I am, that word. So just find something that resonates for you in this moment, and then change it just ever so slightly to something in me is feeling, and then fill in that same word. So we're making a very subtle and yet significant change from I am or I feel to something in me. We're developing a bigger sense of ourself so we can find a way to listen to and care for those parts of us that may not be feeling so good, might be creating challenges for us. So something in me. And then feel into your body. Usually the throat, the chest, the stomach area, or the abdomen. And as you listen and sense that feeling that you experience, notice if you can sense it in some way in your body. You might feel it in your chest or your heart, your gut or your throat. Just listening. Is there a sense of that feeling within your body, that something in me? And then if it feels right, you can place a hand on it, like you're gently just taking care of that something in you that feels and senses some particular way. You could put one hand or both hands, as if it was a friend of yours that was saying, I'm feeling this, and you might just put your hand on their shoulder. So just, if you're sensing anything, something in me. Just finding a way to be with that in a tender, caring, listening way. As if you're listening to a friend and how it feels. And then you can say to it, I understand. Of course you feel that way. With what you've been through, of course it feels like that. Of course there's worry or tightness or a trembling or an aching. And you can just softly let it know, I'm here for you. And then just take a few breaths with it. And then you could just thank it for letting itself be known, for letting you be with it. And let your hands rest. Come back to the room. Come back to sensing yourself and your body with your breath, your ribs moving as your lungs expand and relax. The support of your skeleton through your pelvis and spine. Gently begin wiggling your toes and your fingers, and softly open your eyes and come back into the room. Thank you.